And I wanted to talk a bit about the hormone side of it as well, because you also have discussed how yoga, and then I guess more broadly, it would go into the mental and physical sides of it as well, can support females' hormones. Talk to me about that. What does that mean?
So all forms of exercise are is beneficial for regulating and improving hormones. Um, in particular, exercise can regulate things like our cortisol levels and our insulin levels, and also our sex hormones, which are crucial for our menstrual cycle, fertility, and of course things like our mood. I do caveat this by saying, yoga is not the only form of exercise that can do that. All forms of exercise can help reduce cortisol. Um, but when we have, for example, high levels of cortisol, this can interfere with things like ovulation and hormonal balance. And I always like to talk about, I see a lot of women who are very physically active. So they might be doing lots of like HIIT exercises, your like lots of intense running and just intense exercise classes, which is great, especially from a cardiovascular health perspective, but not necessarily from a nervous system perspective. And I've worked with many women to actually alternate some of their workouts with, yes, still their high intensity strength training, but then maybe even some yin yoga or some restorative yoga to really get the balance right, because we can sometimes push ourselves into overdrive and push ourselves into a higher level of cortisol, which can then, yeah, impact our hormones. And also from like a gut health perspective, we have something called the estrobolome, which is the way that our gut microbes synthesize forms of estrogen. And so when our gut health is out of sync or out of whack, then this can directly impact our estrogen levels. So that's why it's really important to again regulate our gut health and our gut microbiome to help with that estrobolome.
I've used this example before, and you've got a really stressful day ahead and you've got loads of meetings and you think, okay, great, I'll just do a quick hit workout. And suddenly, maybe you're even going to do it fasted, which for women is not a good idea. Have something, anything, even if it's like half a banana or anything,
Yeah.
it makes such a difference. But yeah, and then you go in and you do it, and then you're like, okay, well, I've done that, so that's great because I've ticked it off my to-do list. But your heart rate is high, your eyes are doing that thing of like darting about, what's next, because you've not had that moment of, I'm waking up, I'm actually looking around me. You've gone from one thing to the next thing, and you can really carry that on all day. And you imagine if you did that 5 days a week, and then you had a really busy weekend because you've been working all week and you've been doing your hit classes, and then it just really piles up.
Yeah.
And you can really then see in that example, it's quite easy to be like, well, that person's going to get burnt out,
Yeah.
But hold
Exactly.
on, that person's us. We'll just apply it in different ways. It might not be that sort of example, but I think it's so easy to identify it because, I mean, you knew all of the information, yet you're in hospital with gut issues.
Mm.
It's, if it was that easy, we could identify it ourselves, but it's really not, is it?
Yeah, it's not exactly. And I do find that in this day and age we're living in, we are living in a world of, the wellness industry is $1 billion industry, and we are living in a world of people convincing us we have a problem and then selling the solution, and biohacking and longevity and supplementation and saunas and ice plunges and like tracker watches and heart rate monitors, and putting all of the responsibility and the onus on the consumer, when in reality a lot of it is to do with the environment that we're living in. Like we said, it's to do with like larger corporations and industries, and if they could change the way that things are set up, then we would all be, I think, happier and healthier. And I mean, this is maybe a topic for a conversation for another time, but like this is why I have a slight issue even with like all of these trackers and tracker apps, because the work I do with patients is to get people to feel into their bodies and work more intuitively with how they're feeling. And often these trackers and all of these supplementation protocols that you can follow takes you out of your body and focusing on something else.